Open Research is a nonprofit research organization whose goal is to learn from participant experience in direct cash transfer programs to better understand the entirety of that, both the potential and the limitations of cash transfers, unconditional cash transfers. The real comprehensiveness of their study allowed them to gather data in a more rigorous measured way and to understand its impact. And they came at it, which I think is really helpful to us in a sense of not trying to prove it's good, but just really from a research objective standpoint. What is it versus how do I make it sound great, right? So I am joined here today by Dr. Elizabeth Rhodes. Dr. Rhodes is the research director at Open Research, a nonprofit research organization. She's led the Open Research Unconditional Cash Study since its inception in 2016, managing the development and implementation of a 3-year, 3,000-person randomized controlled trial of guaranteed income in 2 states. The Unconditional Cash Study research has received grant funding from NIH, NSF, JPAL, and the Russell Sage Foundation, and I'm sure that Dr. Rhodes can explain what those acronyms were. But initial findings were released from this study last July in 2024, and analysis is ongoing. In addition to her work here at Open Research, she's been a co-investigator on evaluation of Give Directly, one word, Project 100 Plus cash transfer program, and is a principal investigator for evaluations of the Chicago Resilient Communities Pilot and the Cook County Promise Guaranteed Income Pilot. Dr. Rhodes has completed a joint PhD in social work and political science at the University of Michigan, and where her research focused on health and education provision in informal settlements. And she holds an MSW from Michigan and a BA in government from economics. And Dr. Rhodes, thank you so much for being here. Your presentation is up, I hope, yes? And I turn it to you.
Thank you so much. Should I just let you know when to switch slides? Does that work?
That works great.
Excellent. Thank you. Thank you all so much for having us here to present. We're really excited to share our findings. We have a lot to cover. I'm going to try to fly through it fairly quickly so that we have time for questions and discussion. So we can move on to the next slide. So we started this project back in 2016, and I would say the world looked quite a bit different then. It was the summer of 2016. There was not much happening in the US in the cash space. The safety net had moved so far away from unconditional cash, and there were some unconditional cash studies in Africa and certainly programs in Latin America, but there was not much happening here. And so I would say we came at this from very different perspectives, but we did have shared goals. So, I mean, the world in 2016, we saw that GDP growth was dwarfing growths in median household income. We began to see these huge increases in income inequality and declining intergenerational mobility. Really, the significant share of new jobs that were contractor or gig jobs was growing, and a lot of that, was coming with those jobs offer more flexibility, but also more uncertainty, income, volatility, and fewer benefits. And so on the one hand, so Sam Altman, who at the time was president of Y Combinator, startup incubator, put out a blog post, which was a call for research. He was wanting to study the idea UBI, or universal basic income, had resurfaced and was being talked about in some circles. And so his idea was we should study this. I think he said, I think it's good to start studying this early. It was about the same time that he was also founding OpenAI. So he definitely, that was on his mind. He had concerns there, although the public discourse was more around the idea of robots taking jobs, and there was a lot of skepticism. It was not the generative AI that we're seeing today. And there was a lot of discussion, but he knew there wasn't much data. So he said, let's study this. And I came from a different perspective with my background in social work, seeing some of the limitations of the existing social safety net, some of the structural barriers. And to me, the idea of thinking outside the box, exploring something new, trying some new ideas was really exciting. It was a chance to design a study that could inform, not just unconditional cash policies, but also if we did it right, understand the challenges people are facing in ways that could inform a broad array of policies to alleviate and prevent poverty and economic insecurity. Go to the next slide. And as mentioned, this was not designed as a referendum on UBI or any specific policy. Our goal really was to explore, to ask bigger questions, to understand really more of the nuance of people's lives. A lot of our data collection is based on employment surveys that were drafted and validated many years ago when the labor market looked quite different. So what happens if we collect a lot more data and try to better understand over a long period of time the granular details of people's lives? We believe that as an organization, we're trying to be a new model for research, conducting outside of academia, bringing the strengths of academia with some of the strengths of more the flexibility and innovation of a startup. And we believe that research is valuable, and we aim to conduct impact-oriented research. That was the starting point for this study. The study itself, as mentioned, was a randomized controlled trial. It took place in 2 different states. We originally recruited from about 10 counties each in Illinois and Texas. And unlike some of the very place-based, city-based pilots, we included people across the state. So we wanted a mix of large urban, medium urban, suburban, rural participants. There were 3,000 of them. We limited it to individuals ages 21 to 40 at the time of enrollment, because we know this could have a very different impact across the lifespan. And we decided to limit it to younger individuals who are more likely to be having children and making some career decisions. We also ensured that household income did not exceed 300% of the federal poverty threshold at that time. In our next slide, we show a bit about participant demographics. I'll go through this quickly, but our aim was for the sample to reflect the eligible population in the county. So we used the American Community Survey data. As you see, there's a larger percentage of female participants because those females are overrepresented among lower income households. 26% had a college degree. The average household income was $29,900. We undersampled, if you see the greater than 200%, between 200 and 300% was 23% of the population of the 3,000. We 40% were between 100 and 200, and 37% were below the poverty threshold. Over half of them had children, and 85% of them were renters. And our approach to research, so we took a very much a believe in mixed method approach. So we have quantitative research that explores what happens when individuals receive unconditional cash each month. We have defined narrow research questions. We pre-specified a range of outcomes that we wanted to look at. We have a large sample size so that we can explore the statistical significance of associations. But through this, we had interviewer enumerated surveys at the beginning, middle, and end. We had short monthly surveys that we sent out, web-based surveys. We have administrative data, some of which we're still getting from states in terms of school outcomes, and we have UI data and things like that for employment. We also have financial transaction data, credit bureau data. And on those surveys, we had about over the entire study, we had 96% response rate average, which very little difference between treatment and control. So it was a very, very engaged population. We also have the qualitative side, which really explores how and why receiving cash transfers affect people's lives. So we had a group of 156 people who we interviewed 6 times. And sometimes these interviews are 4, 5, 6 hours long. So we really get a lot more context about what's going on in people's lives. We can better identify some of the mechanisms of impact, what constraints and challenges people still face. And I think really want to highlight that was something going in. We wanted to understand both the ways that cash is beneficial and the limitations or where it's not enough. Again, part of that exploratory approach. And then for the next slide, we collected data on, we know that cash could affect, one of the challenges with studying cash, which I'll keep coming back to a lot, this presentation is that it affects so many different dimensions of people's lives. And so because this was an initial, like a foundational study, we looked at things like children and parenting. So child outcomes, parenting behaviors, cognition, so much work on the scarcity mindset. So we collected data there, consumption and finances, crime, employment, geographic mobility, intra-household dynamics and relationships, material hardship, physical and mental health, political attitudes and behaviors, social and subjective well-being, and time use. So you name it, we tried to measure it at some point during the study. And the goal of this was really to get this multi-dimensional understanding of how cash affects people's lives. So to our findings. We have, first of all, I should say that analysis is ongoing. So what we're beginning to hit the tip of the iceberg here. But I would say the real thing is that there were 3,000 participants and there are 3,000 stories. Cash is flexible and the impact really depends on each person's needs and goals and experiences over the course of a study. So one that, I always tell this story that we should have known this from day one because I had the privilege of calling a bunch of once people were randomly assigned to receive $1,000, we called and notified them, answered any questions they had. And I probably talked to 200 different people. And I think I heard 200 different needs expressed in that moment for what they were going to do with their first $1,000 payment. It was in the middle of COVID. Someone's father had just died and she couldn't afford the funeral expenses. Someone else had been in a car accident and couldn't afford the car repairs, so they didn't have transportation. Another person had graduated from cosmetology school, but couldn't afford the license to get a job. And that goes on and on. There were hundreds of different needs. And in that moment, you could see the impact going out in so many different directions. Cash, $1,000 a month wasn't enough to meet all of those needs completely, but it was the one thing. There was no other program that we have that could have addressed all of them in that moment. And so right then, that's where you see it allowing people to, it's flexible. It allows them to meet their specific needs and to set their own priorities. And I think what we found then is that cash does increase possibilities very much for many people. But those possibilities do look different based on recipient circumstances. How someone chooses to use the money depends on their circumstances. People who are better off to start with, or maybe better able to meet their basic needs, they don't have to put all $1,000 towards paying for their housing. They're able to they have more choice. They have more possibilities to decide, do I want to invest in this? Do I want to make these decisions? And so in some ways, if you just give everyone the same amount of money, you're not going to see, there's a differential impact there. But the biggest thing is that average effects don't tell the full story. One person who uses it to pay for housing, another person uses it to pay for transportation. This person's better off in housing, this person's better off in transportation. You average it out, not much change. Next slide. So I'm going to talk about the initial findings from the study today. And I will say that data collection is ongoing and we're still analyzing the data. So this is just the beginning of what's to come. I'm going to talk about some findings on expenditures, savings, financial health, employment and entrepreneurship, mobility, education, and health. And I think, the effects and the findings are like nuanced. But one through line that has emerged so far is the ways in which unconditional cash gave recipients a sense of agency, an opportunity to make choices about how to allocate money and how to prioritize their needs and the needs of their family. Cash created possibilities. And so, in the words of one participant in the qualitative research, the money allowed them to dream bigger, do more, consider more. And often, that's sometimes an intangible benefit, but is likely to persist long after the payments. Next slide. So at the top level, this shouldn't be surprising. It seems somewhat obvious, but the majority of the money was used for people to meet their basic needs. We saw the largest increases in monthly spending were on food, rent, and transportation, especially for the lowest income. We do see differential, impacts based on those income groups that I talked about earlier. So those below the poverty level spent far more on basic needs than those above it. One of the more interesting things that in percentage terms, the largest increase relative to the control group was actually in financial support to others outside their household. So that increased by $22 per month, which is 26% of the average for control participants. So again, we begin to see the impact of the cash diffuse across friends and family as well. And there was a $310 overall increase in monthly spending on average. And again, here you can see, we don't see huge changes in things like vacations or alcohol, tobacco. The biggest ones are food, rent, transportation, support to others, children, health. So the results suggest that, larger temporary transfers do increase short-term consumption and improve financial health. We don't see this really long, consistent improvement in financial position, net worth. But I think one of the things we see with the savings, so on average, over different points in time, household savings and bank accounts increased by $792 compared to the control group. And it was even larger for individual savings. It was $1,048. And when we asked people about sort of the maximum savings during the program, there was about a $2,372 difference, which was 35% increase over the average savings for control group. And I think that there was one participant who talked about, I think she was asked about her experience, the savings. She called it referred to it as a roller coaster. She's like, how much time do you have? Goes up and down and up and down. And one of the things that we consistently saw was the share of participants who were experiencing emergencies, unexpected expenses. And, they were working really hard to save. Everyone had a goal of saving money. And so they were saving it, but then something came up and they had to spend the money. And so you did see savings go up and down. But what that showed was also a greater financial resilience. So when we asked people every 3 months, we asked in the past 3 months, have you had an unexpected expense or emergency expense? And then we asked, if yes, how did you pay for it? Or not pay for it? What were the consequences? And so recipients were on average 24% more likely to report paying for it out of savings or cash on hand compared to the control participants. And also recipients were 31% more likely to pay by reducing spending in other areas, just so they had more flexibility to absorb these experiences. So it really did improve their financial health and resilience. We didn't see this large effect on net worth, but again, this is a low-income population receiving $1,000 a month during the pandemic and early pandemic recovery. So we weren't expecting to see that. But I think going back to sort of the average treatment effects, there was one participant who ended up spending, I think, $8,000 of the money. She was a single mom and she was not receiving child support. And so she hired an attorney and paid a significant portion of her money went to pay the attorney's fees, but eventually she was able to get child support. And so that was going to have a longer term impact. So the money allowed her to make that investment. Someone else was able to save $15,000. So there's, again, a wide variation. The next one. So employment is an area where people was one of the more interesting, people are more interested in, I would say. We did see that the unconditional cash transfers led to a modest reduction of employment overall, but there's wide variation across participants, and the different ways that people chose to reallocate that time really reflect how cash increases people's agency and possibilities to make decisions that align with their circumstances and goals and values. So overall, at all different time periods, recipients were about 2% less likely to be employed and worked about 1.3 fewer hours per week. And one of the things we asked each year was which of the months, the previous 12 months, were they employed? And the difference was only 0.26 months, so 8 days. So recipients were employed about 8 fewer days per year. How we see this come out is generally in longer periods of unemployment. So I think the average duration of continuous unemployment is about a month longer for recipients. And that meant they were able to be more selective in their job search. So we did see that they were 6% more likely to be searching for a job during any time period. They were more likely to apply for a job, but they applied for a smaller number of jobs. And so they were more selective. And next slide. Allows you to see over time the employment between the control groups and recipient groups, and the shaded areas are the confidence intervals. And so, though there is a difference, you see oftentimes they're overlapping. So, and that it narrows towards the end. And I think it is also important to put this in context. We had both, we had recruited half participants prior to the beginning of the pandemic. A lot of them lost their jobs. They were working in the service sector or in jobs that were very much affected by the pandemic. And so unemployment was a lot of them were unemployed at the beginning of the transfer, and this definitely shaped decisions. Everyone's employment went up, rates went up, they just didn't go up quite as fast. Okay. And the other interesting thing about this is we do see, as I said before, the averages obscure significant variation. And so single parents, the largest reductions in employment and hours worked were among single parents. And Nathan is a pseudonym, but he's a good example of this. He is a single father. He was working a low-wage job at a pizza place, and he was working 50 hours a week. And as soon as he found out he was getting $8,000, he immediately went into work and said, I want to cut my hours. I want to work when my son is in school. I think he was in first grade. And then I want to be a dad. His father wasn't around. He was like, it's really important to me. And so he significantly cut back his employment hours throughout the program. And he talks about, taking his son fishing and like doing all these things with him, and the benefits that had. And he was very proud of this. And so that's an example of someone who said, I'm going to use this as more of an income supplement in order to replacement, in order to spend this time taking care of my son. They both have similar diagnoses. They're both autistic, and he's like, I was able to teach him things, and it was really important to me. For people who aren't single parents, we don't see that same reduction. Recipients under 30 is another group that were more likely to work less. And we also observed a larger effect on formal education among that group. Doesn't quite make up for it, but we do see a difference there. For people over 30, for example, there's no effect on employment or work hours. And again, it's 3,000 different people making 3,000 different decisions. I think in contrast to Nathan, there was Lisa, who was also a single mom. She was working she was a phlebotomist, and she was being paid $18 an hour, but there were not really any opportunities for growth. And so she was constantly struggling. She got the money and she found a job that paid $14 an hour. So she couldn't have afforded it without the additional income, but it had opportunities for growth. And so she took the job over the course of the 3 years, got multiple promotions, was making close to six figures, salaried, benefits, was in a completely different position. Obviously, that story is not everyone's. There's a lot of variation. Okay. I think another interesting, again, related to labor market stories, we did see really large and significant impact on entrepreneurial interest and entrepreneurial mindset. That didn't always translate into an effect on starting businesses across the full sample, but it was actually, we did see more of this among groups that were underrepresented. So Black recipients were 9 percentage points more likely to report starting or helping start a business by the third year, which was 26% increase. And women were 5 percentage points more likely to have started a business, which was 15% increase. And one of these things, yes, they had ideas for businesses. Yes, they wanted to start businesses. But what I think this is also a reflection of is the ways that the labor market is not working in the context of their lives. A lot of them are single parents, and the jobs don't have the flexibility. They aren't able to meet their kids' needs. And so the idea of having more control over their schedule and more flexibility is they do have business ideas, but it's also related to the challenges with the existing labor market. Okay. So then, this is another area. So what we do see changes in income. So it's not over the course of the graph on the next slide, I'll show you, income increases for everyone over the course of the 3-year study. And but it increases less for recipients, partly because they are working less, or maybe some of them are taking lower paying jobs that are a better fit for themselves. And so individual earned income grew about $1,500 less per year. Most of that came from salaried income. But again, there's variation. So when we disaggregate by state, we did not see a significant difference in individual income among Illinois recipients. That was largely concentrated in Texas. That also led to household income was roughly 2,500 to 4,100 per year less for recipients. And again, the difference was smaller in Illinois. We can go on to the, and again, this depicts the earned income with the transfer amount. So obviously income is still higher, and earned income is higher for everyone. Okay. One of the more interesting things that we did see, again, because this was not limited to a specific place and people were able to move, we saw recipients receiving the transfer were about 10% more likely to move both housing units and neighborhoods. As I said, originally we enrolled from 2 states, and now participants live in 40 states and 2 different countries. And so there was quite a bit of mobility. And another interesting part was recipients who, a lot of people at the baseline were staying with family or friends or had some other housing arrangement that involved not paying regular payments. And they were 5% more likely to actually pay for housing as opposed to living with someone else. Okay. When it comes to education, we didn't see an effect overall, statistically significant effect. The estimates were generally positive. And by the final year, recipients were about 3.3 percentage points more likely to have pursued an education or job training. But the impact was definitely stronger for those under 30. So we want to be careful whenever we start dividing the subsample too much, but we did see they were more likely to be enrolled in post-secondary education and complete more years of post-secondary education. We also saw, again, this ties back to the sense of agency and the sense of possibilities that people began to envision for themselves after receiving the money. We saw that recipients were significantly more likely to report plans to pursue further education and job training. Mental health, one of the things that we saw, we did see a significant drop in both stress and other measures. We have the Kessler-6 and measures of depression. We saw significant improvements in year 1 that faded over time. But specifically related to stress, I think one of the things that came out a lot in our qualitative interviews is that overall, financial stress went way down, but that just gave them more mental bandwidth to focus on other things that were going on in their lives. So for parents, there was an increase in child-related stress. They're paying more attention to their kids and what was going on in their kids' lives. And so just because, they said it's a different kind of stress, even though they might still be stressed, it was different than it was for financial stress. And for health, we saw an increase in healthcare utilization. So recipients were about 10% more likely to have seen a dentist at least once in the past year, which is important because a lot of Medicaid doesn't cover dental care. There was a 26% increase in the number of hospitalizations per year, and recipients spent about $20 more per month on healthcare. We didn't see evidence of improvements directly to physical or mental health. As I said, we saw the improvements in year 1, but they faded over time. We did see a decrease in certain types of drug and alcohol abuse. And interestingly, a lot of that is concentrated in rural areas. Okay. Slide. But again, where we talk about averages obscuring variation, one of the areas where we saw significant improvements in physical and mental health and nutrition and in medical access was for participants who reported skipping needed medical care at the time of enrollment. So again, people for whom they weren't able to get the care they needed and healthcare was an important priority for them, they were able to allocate funds towards that. And we did see improved health outcomes there. I think overall, as you see, one of the things that we see is that really cash is one piece of the puzzle. It is not going to, as much as I think a lot of people, we would love to have one singular policy solution. That's not the case. We learned a lot about, gaps in the current social safety net and ways that cash can work towards that and the ways it provides agency and increases possibilities. But, I think we did learn that it's going to take more, a larger policy framework to address some of these challenges. So coming back to where we started, How is the world different? How is what we learned different? Certainly, the discussions around AI are quite different. It's not very hypothetical. We're already talking about ways in which it's reshaping daily life. COVID-19 completely changed attitudes towards cash. There was a lot more unconditional cash distributed, which offers lessons. Again, there's so much increase in interest, and still a lot more to learn about how to implement it. Um, I think it does present. We see the social contract under pressure from technological and social change. One of the things, there is so much energy and innovation right now around the frontier technology, around bold visions for the future. And one of the things that we would like to see and hoped for is to find similar energy and urgency and possibility around innovations in the social safety net. How do we build a safety net that's flexible, that's responsive, that's empowering, and one that adapts to people's realities? And, I think this, as Lori mentioned earlier, poverty is a policy problem, and public support and the increased polarization makes it, difficult to address some of these things. But, we feel like with the coming changes, it really does present an opportunity for reimagining. And in open research, what we want to do is, how do we ensure that we have the highest quality, like, most useful data that gives people's lived experience a voice in policymaking? And so that's what we want to do. This study is incredibly valuable. We collected so much data. We have a lot to share, but it took 7+ years, and we recognize that the world is changing a lot faster. And so one of the things we are committed to is, how do we collect better, more representative data quicker, and get information to policymakers, to people like you all. And so knowing what is needed, we as an organization hope to work towards filling that gap. So, one of Sam's comments earlier on is that, the steps that we take now will determine who has power and voice and input in the long term to make decisions. And now is a defining moment as we think about how are we going to address a lot of the policy and societal challenges that we're facing. Thank you.
Thank you, Elizabeth. Thank you. Thank you, Elizabeth. That's the first time I saw this, I thought it was amazing. The second time only made me more in awe. So I so appreciate you joining us. Let me open to the task force. Thank you for your attention. Are there any questions, thoughts? Tim, how are you?
I'm doing all right, Babs. Thanks for asking. Mm-hmm. Elizabeth, that's a incredible amount of good information, and I have two questions. One is very narrow and one is very broad. We have a program, it's called EXA, and we're giving $1,000 a month, unlimited time limit on that, as long as a case manager indicates that the individual is still working on their career plan. So it's got that one condition, but it's a small condition. Basically $1,000 a month. The information we've gotten back so far is showing something similar to what I think your presentation was showing, that it doesn't actually have a strong impact on the employment outcomes. Those who receive the incentives versus those who don't receive the incentives and still go through the rest of the EXA case management innovation. Both of them have big increases in their incomes, but it's about the same whether you had the incentive or not. And I wanted to test a theory we have. We don't have data to test this assumption, unfortunately, but my teams and the folks in the field were thinking it's probably because the case managers are using the incentive pot for people who need it the most, and who might not have done equally well as everybody without the incentive. And I'm wondering if that strikes you as more a hopeful assumption, or just what you think based on your experience with similar approaches.
That's a great question. I could definitely, see how, as a caseworker, directing them to those who need it most. could be one explanation. I think also this is also very preliminary. We're really trying to sort of zoom back out and look at what are the key differences, especially among our qualitative participants, because we know them so well. And we know the ones that, for whom this was really transformative and the ones who it's not. And so trying to understand what are the differences there. And one thing we're seeing is both, I think two, very high level things, or one is those who've had a plan or a path. A lot of these are very low wage workers, and it's, they're working 60, 70 hours a week and they're barely making ends meet, and they don't see like what's going to change, right? They can maybe work an extra 10 hours, but they're not able to get jobs that are offering more longer term security. And so that is where you also see people saying, well, this is a chance for me to work 10 hours less or work a little bit less and make the same amount of money. There's not so much of a difference in the change. There are some people who then, like the person who took the $4 an hour pay cut with an opportunity for growth, who see a different pathway. And so for a lot of people, it was they had a plan or they had a pathway. They knew they had an idea of where to go and how they wanted to move forward. And so I think to some extent having that, and then others, I think the other sort of part of that, which ties on, is they had some other, $1,000 a month is a lot of money, but in the context of some of the things that are coming up and the emergency expenses, if it's easy to get, if even when you have that plan, it's easy to get derailed. Something, a car accident or that thousand goes quite quickly. And so for people who had another level of like social support or maybe a housing voucher, or we didn't have that many housing vouchers because it would have made them ineligible for it. But when they had something, or they had like a family who provide housing, when all that $1,000 didn't always have to go to deal with whatever emergency came up, that also helped. And so I don't know if part of the case management is sort of helping them, like what is sort of, I think, seeing a path forward. Again, it ties into that agency. Seems like, again, qualitatively, a big part of sort of different paths.
That's really fascinating because ours has obviously a very strong case management component in it. If I could ask the big broad question, when we started talking about this years ago, one of the examples we used was Alaska as just, among all the examples, here's an area that takes their oil revenue and divvies it up and sends a little bit out to each state resident. And at the time I was like, yeah, well, they have all that oil and everything. And it's not really something that would fit Washington or the rest of the state necessarily. But I wonder what you think, especially being closely connected to AI. It seems like AI could be a disruptor to the workforce at a level that many other technology changes that were very disruptive still don't even reach, right? This could be exceptionally disruptive. And a force for concentrating wealth. Those who are who have the technology and are using it to earn money, they're going to very likely have even more concentrated wealth. So I wonder if times haven't changed, and if it's time to think about how, if we're seeing even more concentration of wealth in tech companies, and meanwhile, it could be that a lot of Americans are losing their jobs. Is there a connection there to be made that that it might be time to look at a more serious model like this?
I think one of the things that we, again, I'm a researcher, and so want to sort of stay in my lane in terms of trying to provide the data. And this actually goes back a little bit to your first question. So I say two things. So one is, even if, what I would say is, even if we've gone through changes, but there's always groups that have been left behind. We haven't done a good job of figuring out, even if some of like changes were better on the whole, they weren't better for everyone. And so we left people behind. So even if there are definitely going to be changes in jobs, like even if there are still jobs and they just look different, who is able to take part in those jobs, I think is the question. And so it's about giving people opportunities to contribute and ensuring, and that definitely involves redistribution of some sort in order to figure out, okay, how do we ensure that people aren't left behind, and how do we give more opportunities more broadly? And it being less about one group saying, this is what we're gonna this is what we're gonna do to take care of this group, and more about how do we collectively make decisions. The other, slightly going back, is I think the one factor that we don't have a lot of data on yet. I mean, we have a little bit tied to the EITC, but the difference between lump sum and monthly transfers, people sort of assume, oh, it's cash all together, but if they have quite different impacts. We see it, the EITC, even when we look at the child tax credit and we look at the impact of the lump sum portion versus the monthly, it has a very different impact, but it's used differently. And help this $1,000 a month help with monthly expenses is helpful. But if you're saying, again, for someone looking for different employment changes, they might need to invest in some training upfront, or do they have reliable transportation to get to a job? Like, there's a number of things that take that upfront investment. And so I think when we think about what other frontiers of studying, it's like, what happens if you give someone a pretty significant lump sum upfront and then monthly support for a while? And so I think the form in which that takes, whether it is, I mean, the ITC is monthly, but again, we see some people going into debt or like using it to sort of pay off. Some people save it to use it for like a large investment. It goes less towards those daily and monthly expenditures.
Thank you. Both of those answers were really helpful, and the presentation was great. Thank you.
Oh, thanks.
Thanks, Tim. Thanks, Elizabeth. Any other thoughts or questions from the task force members?
Babs, this is
Yes.
Lori. I have a question, only if there's no other questions.
I think I saw Rep. Gregerson's hand up, maybe, but it went back.
Thank you. Thank you for this presentation. I'm always going to ask about what any other state is attempting to do with this information. Are there any other states to partner with so we can have a statewide approach to this?
Also, I'm not sure. I know of a lot of cities. I think Cook County in the Chicago experiment, but Cook County, I think, is interested in what a longer term, like more permanent program could look like. But I'm not personally aware. Again, I'm more on the research side, so others might be more aware of what's going on at state level places.
I think I could jump in as well and say there's certainly been a number of guaranteed basic income pilots across the country that they're doing that. I think what was attractive about open research and Dr. Rhodes is the evaluation component of it was very objective in how we went forward. But so I think that there's definitely been some work in Stockton, certainly Michigan, Flint, Michigan in particular has done some work around guaranteed basic income and direct cash transfers. We've got a couple of projects that have been happening here in Washington State that I think have some really good, interesting foundations we could potentially build off. But I see your hand is back up.
Yeah, sorry, I should have been more specific.
Yeah.
The pilot projects are very important to help create more energy and understanding. I'm interested in the policy and where there can be policy examples to be able to implement sustainable, targeted, dedicated revenue streams that can then fund these things. That is what I'm interested in understanding, what those different approaches are.
Yeah. Thank you for that clarification. I actually, and I want to say, and somebody may correct me, but let me do a little bit of research around that, Rep. Gregerson. I think California has recently passed a funding stream to support moving in this direction, and I'd like to look into that, see if I can get us some information. Perfect. Other thoughts? All right. Let me just say thank you again so much. Dr. Rhodes, your presentation was amazing. Thank you for sharing your slide deck. The task force member, oh, I'm sorry. I put in the chat, the slide deck that we just went through is on the Lupro website if you want to take a deeper dive into it or a deeper look into that information. Thank you again, Dr. Rhodes. It was wonderful to work with you on this. I hope we get a chance to talk more.
Thanks so much. Really appreciate it.
Thank you.